Delighted to have you all here for today's webinar on Ultimate Pulmonary Wellness. I'm Dr. Mrunmayee Koltharkar, CEO and founder of The Pulmonary Rehab. And my primary expertise lies in pulmonary rehabilitation as a physiotherapist primarily based in India. It is my pleasure to extend a heartfelt invitation to all of you to TPRs Knowledge Hub, our latest initiative aimed at fostering a passion for learning and growth within the pulmonary community. Today, we have privilege of featuring Dr. Noah Greenspan, an esteemed expert in the field of cardiopulmonary physical therapy, boasting an impressive 30 years of experience in cardiopulmonary rehabilitation. He began his career at the renowned New York University Medical Center's Rusk Institute of Rehabilitation Medicine before specializing in cardiopulmonary rehab. In 1998, Dr. Greenspan founded the Pulmonary Wellness and Rehabilitation Center, a distinguished physical therapy practice in Manhattan dedicated to caring for patients with cardiopulmonary diseases. This center has conducted more than 1 lakh exercise sessions and earned recognition as Best of United States. That's amazing. Dr. Greenspan is also a pioneer in promoting respiratory care and education. In 2014, he established the Pulmonary Wellness Research and Education Society, now known as Pulmonary Wellness Foundation. The foundation's mission is to provide exceptional educational material to patients, family members, caregivers, clinicians, while supporting research projects to better understand the impact of cardiopulmonary rehabilitation and lifestyle changes as well for individuals living with pulmonary diseases. His contributions to the field of pulmonary wellness have extended into the literary world as well. In 2017, Dr. Greenspan's book, Ultimate Pulmonary Wellness, was published, and he generously has made it available for free online. And in 2021, Guide to Pulmonary Fibrosis and Interstitial Lung Diseases was also published. He offers quite a lot of online lectures and webinars under the same banner. Beyond his expertise as clinician and researcher, Dr. Greenspan is a dedicated educator, having trained thousands of patients and hundreds of students and clinicians. His teaching experience includes many prestigious institutions like New York University, Dominican College, New York Medical College, Long Island University. In response to COVID-19 pandemic, Dr. Greenspan took swift action by initiating a daily coronavirus prevention program and later launching the COVID Rehabilitation Recovery Lecture Series, the first of its kind in New York. Dr. Greenspan's involvement in professional organization includes serving as Federal Affairs Liaison for Cardiovascular and Pulmonary Section of APTA. He has also been active member of leadership board of American Lung Association of the Northeast. Apart from his medical pursuits, Dr. Greenspan leads an active and diverse life. He is a New York State Emergency Medical Technician and advanced cardiac life support provider. In addition, he is also a certified scuba diving international open water instructor and underwater naturalist with a passion for shark photography. He's also an artist, musician, and a clothing designer under the creative moniker of Noah G Pop. So get ready to gain valuable insights from this renowned expert, Dr. Noah Greenspan, a true pioneer in the field of cardiovascular and pulmonary physical therapy. Let's make the most of this opportunity and expand our horizons together. So without further ado, let's give a warm virtual welcome to Dr. Noah Greenspan.
Thank you so much. It's my honor and pleasure to be here. And thank you so much for that walk down memory lane. I see somebody has done their research and their internet stalking. Thank you so much. I really appreciate it. It means a lot to be here. Thank you. It's great to see everybody this evening.
To begin with, Dr. Noah, what's that one success story that has touched your soul?
So you know what? When you sent me that question, it was really it was an easy answer and it was a hard answer. And the reason why I say that is because there are so many, like thousands and thousands and thousands, that there's not one success story that stands out. But what I love about these meetings is that as I look around the screen and I see the people here, you don't look very different than the patients that I see every day. Certainly more of you are Indian than the average person that I see every day. But you look like all my patients. And the reason why I wouldn't give you one success story is because as I look at you, I can tell you absolutely positively, each and every one of you can get better. Wherever you are at this moment in time, you can improve. And the key to improving is to try to figure out what are the steps that you need to take to move forward. So I say, you know, if there's one success story, it's everyone on this call, and you can all get better. And I'm sure that through the pulmonary rehab, you've already gotten better. But then it's like squeezing an orange. It's like initially we get the juice and the juice and the juice, and we want to make sure we get the most juice and squeeze the most juice out of every orange and squeeze the most life and vitality and health and wellness out of every life. So the success story is you. And if it's not yet, then it will be soon.
I'm glad to hear that. I'm sure all of our patients would be success story today or tomorrow. But what made you get into pulmonary rehab? We are curious to know about this.
Oh, so now I'm going to get in trouble for this. So here's the thing. So I was working at NYU. It's a story. I will probably go to jail after I tell this story, but then I'll tell it anyway. So I was working at NYU and I was working under somebody that I didn't, you know, it was a very difficult work situation. And I went to the bosses and I said, listen, I cannot work in this environment. I have to get to another environment and another unit, or I have to leave the medical center. And they said to me, what about cardiopulmonary rehab? And as I told you before, when I was in school, I graduated in 1992, there was almost no training in cardiopulmonary rehab. There was almost none. And, you know, I'm happy to say there's more now, but there's still a lot more to go. You know, as I know that, you know, in India, you told me that there's a lot of challenge with awareness. There's always a challenge with awareness. But I started in cardiopulmonary rehab and it just made perfect sense to me, almost from the beginning. The system is beautiful. The way the heart and the lungs work perfectly together. It's like yin and yang. And I love the system and I love the way the rehab works. And I love the lifestyle aspect of it, right? Because unlike certain conditions, there's a lot that we can do to improve our health. If we, number one, if we know about them, right? So you have to know about them, and then you have to make a decision to do them, right? And we all have our struggles. We all have our challenges. It's like, you know, I can walk by my exercise bike every day and I can put a piece of clothes on it for what I'm going to wear tomorrow. But it's taking the step to decide that you want your life to be better. And I've never looked back. I love it. I mean, I've been doing it for decades and I love going to work every single day because I see people get better. And you know, as you know, what can be more important than breathing, right? As many people say, as the American, I think it's the American Lung Association who first said this, but if you can't breathe, nothing else matters, right? And if you think about it, the first thing that we do when we're born is we take a breath in. And the last thing that we do when we die is we breathe out. And everything in between that first and last breath, that's our lives. And so my goal and you know, I've been so fortunate to be able to get into a field and a profession and a specialty where I get to see people get better every single day. So for me, it's love, pure love.
That's great. I always use this quote in most of my presentation that if you can't breathe, nothing else matters.
Absolutely. Absolutely.
What, according to you, is ultimate pulmonary wellness? When we
So
say
when
the
I talk
title
about
itself is that.
yep. So when I talk about ultimate pulmonary wellness, the reason why I felt that it was important to frame things in the way that I did is because in addition to knowing what to do and what is going to be the most valuable, I think there's equal value in knowing what not to do, right? And I think that we all want the magic pill that's going to immediately perfectly make us better, right? We want the pill that's going to help us breathe. We want the pill that's going to help us lose weight, or the pill that's going to help us gain weight, or the pill that's going to make us good looking, right? But that pill's not out there. Trust me, if you could pay somebody to do the rehab for you, I would have done it already. Okay. But the thing is that, especially as more awareness comes, there are going to be people who claim that certain things work that really don't work, right? So if I could get something that's like a little device for $20 online and blow into that for 5 minutes a day, if that worked, everybody would do it, right? But it's not that simple. And so with Ultimate Pulmonary Wellness, I wanted to put together the 5 things that I have found are the most valuable and carry the most weight of all the things that you can do for yourself, and kind of keep out the things that aren't going to do anything for you, right? Because we only have so much time in a day. And I think it's important that we get the most bang for our buck and the most value out of the time that we spend. So in my experience, these are what they are. And, I don't know how it is in India, but in America, we have a very much medication-based and procedure-based healthcare system. So you go to the doctor and you get medicine first thing, or here, go for this procedure, right? How many people, even if we don't have lung disease, don't eat properly, don't exercise, smoke cigarettes, vape, all these different things. And we know that when we exercise and when we start to eat better, we feel better, right? It's not magic. We didn't need medicine to do that. We need to just get up off the couch and exercise. And nobody eats a bacon cheeseburger. I'm sorry if I know that the bacon cheeseburger, no one eats it there either. But the thing is that nobody's eating a bacon cheeseburger and a platter of French fries thinking that this is health food, right? Nobody goes to Dunkin' Donuts and says, this is the breakfast of champions that I'm having here, right? But we do it. Why? We're human beings, right? So in my opinion, these are the 5 most important things, and they're equal, right? So it's not that medicine is very important, right? But it's not everything. And here in America, where medicine and procedures might be 90%, and on the way out of the office, the doctor says, oh, by the way, get some exercise, right? I would love to put just exercise up against medicine, because I bet we could get similar results with just exercise, no medicine. But here's what I think are the most important. Number 1, medical, right? And when I talk about medical, I'm talking about having the right doctor or doctors, taking the right medications, and then taking the medications properly, right? Because I don't know about where you live, but I know where I live, very often patients are given medications with no instructions. How do you use this device? When should I take them? Does it matter what order I take them in? What do I need to do, right? So it's not just having the right doctors, but it's taking the right medications and taking them properly, okay? That's 20%. Then we have exercise, right? And that's one of the greatest strengths of the pulmonary rehab is exercise component, right? We know how powerful exercise is, right? How much better do you feel? I always tell people the hardest minute of the workout is minute 1. You just have to get yourself to the gym. You have to get yourself to the workout, because once you're there, you actually start to feel a little better. And you're like, hey, I can't believe this, but I kind of like it, right? And then you have to get yourself there. So exercise is crucial. Nutrition is crucial, okay? except that when it comes to pulmonary nutrition, there are a lot of misunderstandings. And the best nutrition for pulmonary patients is not necessarily the best nutrition for everybody else. So for example, if you were a cardiovascular patient, and let's be real, we're all cardiovascular patients and we're all pulmonary patients, right? We all have a heart, and well, most of us have a heart, and we all have lungs, right? And the idea is that we have to take care of this, right? But when it comes to heart health, we talk about minimizing, cholesterol, and we talk about increasing carbohydrates, and we talk about, things like that. Now, there are overlaps, okay? But there are some really important things. And I'll just tell you one thing that I almost never hear people talk about, but this is really important for pulmonary patients, okay? There's something called the, I swear, this just flew out of my mind. This just flew out of my, I'm going to tell you what it is. I will remember the name later. Maybe somebody else knows about it. It is in my book. But when it comes to nutrients, so let's say fats and proteins and carbohydrates, it's called the something index. I see Lynn is looking it up. It's called the something index, but it has to do with carbon dioxide production, right? And what people don't know,
glycemic index?
It's not the glycemic index. That's sugar. It's, why can't I think of this? It's, anyway, I'm gonna think of it. But anyway, the idea is that a lot of people don't know that when you eat carbohydrates, that produces the most carbon dioxide of any of the nutrients. And when it comes to carbohydrates, that is given an index of 1.0. And when it comes to protein, protein is given an index of 0.8. And fat is given the index of 0.7. Oh, it's called the respiratory quotient. I'm sorry. There we go. Respiratory quotient. So the idea is that I like to add a little suspense to the story as I tell it. That's why I pretended I couldn't. No, I'm just kidding. But the idea is that if you're a pulmonary patient, right? And one of the challenges, well, there's two major challenges for pulmonary patients when it comes to eating. Some pulmonary patients need to lose weight, right? Because we know that if you're overweight, especially if the weight is in your abdomen, right, that's going to negatively impact breathing. But on the flip side of it, we know that there are many people who, because they're working so hard to breathe, they're burning many, 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 many calories, and they wind up losing weight, right? And if you lose all your fat, then eventually you're going to start to lose muscle. And so that's really important, that if you're overweight, we try to get you to lose weight, but not lose so much weight that if you get sick, you don't have any reserve, right? But if you're underweight, and this is actually more challenging, most people who are overweight wish they had this problem, but for people who are underweight, it can become very difficult to maintain their weight, and people start to lose weight very quickly. And unfortunately, that is not a good sign. So it's really important that people maintain their weight. But when it comes to the respiratory quotient, if you eat a very high carbohydrate meal, and what do people often recommended? They're recommended rice, pasta, bread, things like that if you're trying to gain weight. But what that means is that production, that intake of carbohydrates is going to increase your production of carbon dioxide and make it more difficult to breathe, and send a message to the brain that says, breathe, 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 breathe. So how many people have this experience where they go out and they feel fine and they walk out to dinner and everything is good, and then they have a big meal and then they're like, oh my God, I can't breathe. I had to take a taxi home or something like that. And that's a different issue. That's a mechanical issue. And the mechanical issue is that if you have this food and drink in your stomach, well, the diaphragm now has a more difficult time contracting downward. And if you really have a lot of food in your stomach, like think of in the US, Thanksgiving, or I'm sure you have an equal holiday, where the food can actually push up the diaphragm and reduce the volume of your lungs. So nutrition is really, really important. And then the other things, and depression, right? Many of us have struggles in this area, right? But if you think about it, very few things are as stress producing or as anxiety producing as not being able to breathe, right? If you can't breathe, that is very, very stressful. And, people talk about the mind-body connection all the time, and it's real, right? And sometimes they use it in a cliche way that doesn't really match up in real life. But if you think about it, once you get moving and you start to think, oh, there's my shortness of breath, how many of you, our heart rate beats faster? We start to breathe more quickly. We start to breathe more shallowly, right? And now we're more short of breath. And that more shortness of breath will increase the anxiety. And it's this cycle, right? There's a lot of cycles when it comes to respiratory disease. But it's this idea that if you can't breathe, then you're not going to do these activities. If you're afraid that you're going to get stuck, you're not going to do these activities. It's like if you can't swim, you're not going in the pool, right? And the key is really to manage your stress. And how do you manage your stress? By learning different techniques, by having different tools that you can use and practicing them when you're not in distress, right? Like, don't practice putting on the life jacket when the boat is sinking. Like, practice it when the boat is not sinking. And it's the same thing about breathing. So we want to get you good at these things in a calm environment. And then over time, you get better and better at them. And then eventually, when you start to get these feelings, you could say to yourself, stop, I know what to do here. I know what to do because I've been taught different techniques. And we say, stop, assume the position, find the right position for breathing, breathe in through your nose. But again, stress, anxiety, and depression management, it can be depressing, when you're diagnosed with a respiratory disease. And how many times do you go and we go to Dr. Google and he says, oh, you will get more and more short of breath and then you're going to die. Of course, who's not going to be stressed in that situation, right? But what I'm going to tell you is that there's a lot of things that can be done. And the more of these tools that you incorporate, the better off you'll be and the more control you'll have, right? I think one of the things that we all fear most is not being able to be in control of things, right? Not being able to control our breathing, not being able to go to the grocery store because we're afraid we are not going to be able to breathe. And then the final component of ultimate pulmonary wellness is prevention of infection, right? And the reason for that is because we know that a cold or the flu or COVID or pneumonia for somebody with a chronic respiratory condition is not the same as for somebody who has two healthy lungs, okay? And so little things, frequent hand washing, right? We're all guilty of it. We go out, we're on the elevator or the escalator, we have our hands all over things, and then we get an itch on the nose and we go, oh, and guess what? Everyone who touched that elevator is now touching the inside of your nose. Or like in New York City, the subway, like I always want to do an experiment, go take some cultures on the bar that people hold on the train. And you know what? We don't think about this, right? But frequent hand washing, wearing a mask if you're going to be in a compromise. I mean, the one thing about COVID, there's nothing good about COVID, okay? But I can tell you this, many of the cardiopulmonary patients that we've been seeing for all this time actually did better in terms of COVID. Why? Because we've been training them for years on how to prevent pneumonia, how to prevent the common cold, how to prevent the flu, and all the things that are going to prevent pneumonia, the flu, the common cold, and COVID are all the same, right? And the final one I'll say is vaccinations. And I'm going to go get my next COVID booster today. But that to me are the most important things, right? And then, of course, somebody's going to come and they're going to try to sell you a product. They're going to say, if you do this, it's going to strengthen your muscles and you're going to be good looking and be able to date a supermodel. But the idea is that I like to keep things basic because there's a reason why we call certain things the basics, and it's because they're the best. Long answer. I apologize.
That is great insight so far. So we do have two questions. Let's take those and then we'll go ahead. So what nutrient is important? So Ramana is asking. So anything particular that lung patient should focus on their diet, as you mentioned, carbohydrate, less carbs, but what else that they should?
So if you want to talk about what nutrients, okay, so number one, we definitely need protein, right? Why? Because protein is what is going to allow us to build and maintain muscle and build and maintain bone. So protein is important, but not a whole plate of protein, some protein, right? Fats are very important, okay? But again, not saturated fat, fats that are healthy, okay? Things like olive oil. Like if there's a perfect food, it's olive oil, right? And you can make everything in olive oil. You can fry in olive oil. You can add it to every salad. You can add it to every dish that you make, because the healthy fats, not only are they not harmful to your cardiovascular system, but they're actually cardioprotective and they're anti-inflammatory. So if I were going to say one thing to add to your diet, if it's not in your diet, olive oil, and have olive oil at least twice a day. Okay. If you're trying to gain weight, fats, healthy fats are also very good, because as compared to protein and carbohydrates, which have 4 calories per gram, fat has 9 calories per gram, right? So if we talk about our stomach, where we have limited space and we want to still get a lot of, a lot of nutrition, fat is a very high calorie and healthy thing to add. Now, here's something that's going to surprise you. If you're trying to gain weight, okay, then I think you should never drink water. Okay. And I know that we're always telling people, drink water, drink water, drink water, right? Why? Because we need fluid in our body. But if you think about the stomach and the abdominal cavity and the thoracic cavity as a suitcase, right? If you overstuff one side of the suitcase, well, it's going to encroach on the other side of the suitcase. And what I mean by that is that if you overstuff your stomach, right, it's going to encroach on the respiratory system and the thoracic cavity, okay? But here's something that's important. Your body doesn't care if it's a liquid, solid, or gas, right? So if we have gas and we're bloated, that also makes us more short of breath, right? If we drink a lot of fluids and our stomach is full, that also makes us short of breath. If we eat a lot of solids, that also makes us short of breath. But here's the thing, okay? If you're trying to gain weight, then you don't want to fill yourself up with plain water, because it has no calories, right? It has no calories. It's just taking up space. So it's like if you were packing your suitcase and it came with some of those plastic bags that are blown up. Does nothing for you, right? It just takes space. But you should be drinking something like milk, or you should be drinking something like juice, something with calories every time. And if you're trying to lose weight, then you should only drink water, because we know that there's a lot of calories in sodas and, juices and things like that. So all these things, add up. And, I don't expect you to remember every single thing that I say at this moment. But what is a really good way of doing this, and the idea of ultimate pulmonary wellness, is to kind of put all these things on a plan and say, well, what are the good things that I'm doing now? And what are the things that I have to add to this? What are the bad things that I'm doing now? And what do I have to take away from this? And it's not the same for every single person, right? We have to help you find what's going to be best for you as an individual. Because if I say to you, hey, you know what? Avocados are super healthy food, but you don't like avocados, or even worse, you're allergic to avocados, then that doesn't help you at all, right? So it's really about finding the right combination for each individual. And the other thing I'm going to say is, a lot of times when people talk about what nutrients are important, we talk a lot about supplements, right? So a lot of times I'll see a patient who's taking 7 medications, but then they're taking 23 supplements, right? Supplements are not the be all and end all, right? And this is one of the things that I mean when I say we want to give you the most bang for your buck and eliminate some of these things. A lot of people are taking things that, for all purposes, probably don't do much for them, right? Probably don't do much. They do a lot for the supplement companies, okay? But they say in the United States, we have very expensive blood and urine because of all the supplements that we take. But it's not where it's at. Don't expect to find that one supplement that's going to do it for you, and all of a sudden you don't have to exercise, or you don't have to do your airway clearance, or you don't have to take your medicines. It's all of these things together that work best.
So we do have certain more queries about diet itself. So there's
Okay.
Mr. Kamlakaran who is mentioning that after lunch, I feel very breathless and tired. So any tips that you want to specifically mention here, suggest here?
Yes, absolutely. So again, that's not uncommon, right? And it makes sense. So why do we get breathless? Again, if this is full, if this side of my suitcase is full, it's going to push into this side of the suitcase. And what that means is it's going to push up against my diaphragm. The diaphragm will now have increased resistance, and the diaphragm contracts downward. Okay. So the thing is that if your stomach is full, then it's going to increase the resistance to the diaphragm, and it's also going to push up on the lungs. So that means that you will have less air with each breath, okay? And by having less air with each breath, that means you have to breathe more frequently and work harder to breathe. That's one aspect of it. So what do we do about that? Number one, not have a big meal, okay? And so having more frequent meals, but having smaller meals. And another thing that you could do is you could take your bronchodilator 15 to 30 minutes before you have your meal, right? Your short-acting bronchodilator like albuterol, because what that's going to do is it's going to open everything up before it gets challenging, okay? Once you're super full, then it's going to be harder to get the proper use of the bronchodilator. But if you know that, hey, every time I have lunch, I get short of breath afterwards, well, then that means that take your bronchodilator. I think that will help. Have a smaller meal, have less carbohydrates. And then the reason why you get tired is because blood flow is all going to go to your stomach, right? So when we talk about the autonomic nervous system, there's two branches. There's the sympathetic nervous system, and there's the parasympathetic nervous system. So the sympathetic nervous system is focused on fight or flight or freeze. That means if you're walking and all of a sudden a gorilla jumps on you and tries to take you back to its cave, you have to either fight it or run away. And all the body's systems are going to work towards that. That's the sympathetic nervous system, okay? The parasympathetic nervous system is rest and digest. And that's what happens after we eat, okay? And the rest and digest is what makes you very sleepy and makes you want to take a nap after lunch. And if somebody says, hey, let's go exercise now, it's not going to be good because all the blood is going to be in your gut and your stomach as opposed to in the working muscles where we need it.
I think so that answers most of it. But there are certain patients who are on oxygen therapy also. So I think so that would be better if they take oxygen while having their meals. That might make further difference. Right?
Absolutely. Absolutely. And you know, oxygen is one of those things, right? It's important. If you need it, you should be using it. Okay. And one thing that I tell people is it's not always just how you feel, right? Because some people are very short of breath, but their oxygen is still very high, right? So they're short of breath, but their oxygen is 98%. So they say, how could I be short of breath if my oxygen is 98%? And that has to do with the mechanical aspects of, the eating, but it can also have to do with the mechanical aspects of COPD. So the obstructive aspects of COPD or the restrictive aspects of pulmonary fibrosis, right? But I always tell people, use your instruments as your guide. So in other words, if your oximeter is telling you, hey, I'm 88%, you need more oxygen. And sometimes, at least here in the US, people are given a very strict oxygen prescription, right? And they're told 2 liters at rest, 4 liters with exercise, right? But if you're exercising and you're on 4 liters and that 4 liters isn't keeping you in the 90s, then we need to turn it up. Use your instruments and your oximeter as your guide.
Thank you for that. So if you're lactose intolerant and pre-diabetic, what can you drink besides water? Mary is asking that.
That's a great question. So if you're lactose intolerant and pre-diabetic, so you don't want to have the juice, okay? You don't want to have the milk products, but there are non-dairy protein powders, and there are protein powders that have 0 carbohydrate. So if somebody's really trying to gain weight, then what I recommend is that they have a protein powder that has no carbohydrates, and that's the start of it. And then you can put in some, some lesser low glycemic index fruits or nuts or things like that. And then also add in the olive oil to that. But yeah, if you're lactose intolerant and pre-diabetic, you have to be very careful with that.
Thank you, Deva. And we have one more with respect to this diet. Did you ever hear of taking chlorophyll drops for increased oxygening?
Over the years, I've heard of taking chlorophyll drops for just about everything under the sun, including rubbing them on your feet if you have athlete's foot, okay? But I'm not saying I know for sure, but I don't believe that chlorophyll drops are going to significantly increase your oxygen. I mean, I just don't see how that can be. You'd have to have a whole field full of chlorophyll, I think, to have it, have an impact on your oxygen. I'm not saying it's not healthy, and I'm not saying it doesn't do anything. But again, if people say to me, should I take my albuterol or take some chlorophyll drops? I'm going to say probably take the albuterol.
That's the best way to go ahead. So it's all about lifestyle modification, right? That's
Absolutely
what we are looking at. So what are the most common myths that you have come across, and how do you overcome them? How do you tell patients to overcome those?
Common myths. Okay, so let me give you some good ones. So number one, shortness of breath. And this is what I was just talking about, but shortness of breath means you need more oxygen, right? So it doesn't necessarily, sometimes it does. So in other words, again, I can be very short of breath, but my oxygen could still be 98%. And if my oxygen is 98%, then giving me supplemental oxygen is probably not going to help my shortness of breath much, right? Because that's not the limiting factor. It's something else. It's either my obstruction, my restriction, my stress, my anxiety, the fact that I just ate a giant lunch, one of the two. That's one myth. Another myth, we use oxygen a lot for exercise, a lot. And we will give people as much oxygen as it takes to remain saturated. And sometimes we give people oxygen who don't use oxygen anywhere else but in rehab. And the reason for that is because, we want to give you all the support to get the most exercise possible. And a lot of times, I first started treating pulmonary fibrosis in 1995. And at that time, there was very little rehab for pulmonary fibrosis patients, and there was no treatments. So now we have OFEV in the United States, and we have Esbriet, right? Pirfenidone and nintedanib. But the thing is that at that time, there was nothing. And so doctors very often didn't even screen for it, right? Because their thinking was, hey, even if I find it, there's no treatment. So why should I go screen for it, right? And a lot of times these patients were told that they're too sick for rehab because they'd come in and their oxygen would be 90% sitting in a chair. Then they would stand up and it would be 80%. Then they would take a few steps and it would be 70%. And to me, that didn't make any sense because what was happening is people were being told you're too sick for rehab. And what does too sick for rehab mean? If you're too sick for rehab, that means go home and wait to die, right? Because nobody goes home and gets better on their own. You need some help. So at that moment in time, we started giving people as much as 100% oxygen. And what we found is that when you correct for the oxygen deficit, that they respond very well to rehab and their bodies can get stronger. That's one thing. Here's another gigantic myth, okay? And I don't know if this is a myth where you are, but it's very prevalent in the United States. Many people believe that if you get too much oxygen, you will stop breathing, okay? Have you heard this one? So this is based on something called the hypoxic drive theory. And what that means is that for healthy people, the first things that make us breathe are when our carbon dioxide goes up in our blood and when our hydrogen ion goes up in the blood, which means the blood becomes more acidic, and then when our oxygen goes down. So this relates particularly to patients with COPD But some people believe that because people with COPD often retain carbon dioxide and have these chronically high levels of carbon dioxide, they feel that they stop responding to high carbon dioxide and now respond to low oxygen to make them breathe. And so what that means is that there are people who believe that if you give somebody that oxygen, that there's no stimulation to breathe. In 31 years as a physical therapist and 21 years as an EMT, I've never seen somebody stop breathing because they got too much oxygen. I've seen a lot of people stop breathing because they didn't have enough oxygen. So again, use your instruments to tell you if you need oxygen or not. If you're 85%, you need oxygen. I don't care how you feel, okay? And the downside of being hypoxic or not having enough oxygen increases your chance of coronary insufficiency, meaning that your heart won't get enough blood, increases your chance of arrhythmia, increases your chance of heart failure, increases your chance of pulmonary hypertension. So it's like once we get this idea that, hey, we have a deficit, we must protect that deficit at all times and make sure that you're well saturated. I think those are some good myths right now. And if you have any that you know of, I'd love to hear some.
So to be frank, we have maximum patients of fibrosis, ILD, rather than COPD.
Okay.
And the most common myth is they're not willing to take oxygen because they feel you will get addicted to it. That's the term most of the patients use. Okay.
Right.
So even if their saturation is dropping, but then there is social embarrassment walking with oxygen outdoors, they are not willing to do that. So this is something I would say a myth per se, but this is the biggest challenge that we come across most of the times.
Very, very common. Okay. And that's a tough challenge. Okay. But if you have ILD, right, we know that patients with ILD have a substantial drop in oxygen, right? Even more so than people with COPD at times. You have to supplement. You're doing yourself a very big disservice by not utilizing the oxygen. Like you're putting yourself at great risk at the moment, but also over the long term, right? And we want to preserve lung function as much as possible, and we want to preserve heart function as long as possible. The other thing is, some people say we're all addicted to oxygen, right? We all need oxygen. But the thing is that using supplemental oxygen doesn't mean that you will continually need supplemental oxygen or more supplemental oxygen, right? Like a lot of people feel like once you start, then, it keeps getting more and more and more and more, and you need more and more and more. It doesn't work that way. And in fact, the opposite is true, which is that, if you start supplementing with oxygen, like we do with exercise, right? We can get you up to much higher levels of exercise using oxygen, because if you go to 85%, we have to stop the exercise, right? But if we correct for the saturation and we're able to get you more and more vigorous exercise, then your body actually becomes more efficient at using oxygen at all levels, meaning during exercise and at rest and during sleep. But a good way to think of it is if your life requires this, right? Like one of the problems I have with a lot of pulmonary rehabs is I believe they under-exercise people, right? So you walk in and patients are walking very slowly, but they're walking for a long time. But if this is what your life requires, I can exercise you down here until the cows come home, okay? But that doesn't mean that your life gets better, because your life needs this. So you could do this for a long time, but you can't do this. But if I can give you that oxygen and then I can exercise you up here, well, then your life gets a lot better. So I agree, you don't get addicted to oxygen. And just along that, but one thing I want to say also about the social anxiety, understood. I mean, I totally understand it. Okay. But there's a saying, and it says, most people wouldn't worry so much about what other people think of them if they realized how little they did, meaning how little other people actually think about you, right? Like you're very self-conscious, and I can understand that. It's like if you have an eye patch, you feel like everybody's looking for you. Or if you have a pimple on your forehead, you feel like everybody you walk up to sees this giant pimple, right? And it's not really like that. And even if it were like that, you have to live your life for you, and you have to do what's best for you. And the other aspect of this that I want to bring up, which is something that it's similar, but it has to do with a rolling walker, right? When people use a rollator, okay, there's a lot of benefits to this. And a lot of people don't want to use a rollator because they're like, I'm only 85 years old. I don't need a rollator, right? But there are people who tell me I can't walk a half a block. And we keep rollators at our center and we loan them out to people, because I know if you don't want to use a rollator, you're not going to buy a rollator. You're not going to go online. You're not going to buy a rollator. But if I say, hey, take this for the weekend, bring it back on Monday, then they want one, okay? And the reason for this is because your body gets good at doing what you ask it to do. And if you ask it to sit on the couch and flip the remote control as you watch, episodes of The Good Doctor, well, that's what you get good at. If you ask it to walk, that's what you get good at. And the rollator does several things, okay? Number one, it helps with your balance. Number two, it gives you a seat where you can sit down. Number three, it gives you a place you can put your oxygen. But here's the most important thing. And I saw that you guys posted a little educational thing about this, about positions of recovery from shortness of breath. And the reason why this is so effective, okay, there's something called open chain activity. And then there's something called closed chain activity. And I've never heard anybody talk about it related to the respiratory muscles. I've only heard people talk about it as it relates to musculoskeletal, orthopedic, neurologic. But if you look, this is open chain activity. And what I mean by this is that my thorax is the fixed spot and my arms are moving around my fixed thorax, right? And in open chain, the chest does this, and the back muscles do this, and the shoulder muscles do this, and this, and this. But when you hold on to that rolling walker, or when you put your arms down and lean over, or when you put your arms on your knees so that you can catch your breath, okay, by closing the chain, no longer is my thorax the fixed area, but my arms become the fixed area, and the chest muscles and the back muscles and the shoulder muscles actually work in reverse to help elevate the rib cage and take a deeper breath. So, oxygen is one of those things. It's like, I understand people don't want to use it, but trust me, when you can do less and less, those people are not going to be there to go grocery shopping for you, right? They're not going to be there to do the work for you, okay? You need to make sure that you're taking care of yourself. I'm used to people staring at me, okay? I'm funny looking. I've gotten used to it. I don't worry about it, okay? I don't worry about it. And when it comes to, oxygen or a rolling walker, these are two valuable tools. Like if somebody came to me right now and said, I'm so short of breath, I can't even walk a quarter block. I have to stop 3 times, every 50 feet. And if we did nothing else for them, if we didn't tell them a single thing, but we just gave them a rolling walker and some oxygen, if they came back in a month, they'd be a new person. They'd be speeding. They'd go from turtle to rabbit.
Thanks, Noah, for that. So even if there are limited resources, you can always walk, right? Always
walk. And you know what? I know that that's a problem. I mean, it's a problem here in the US. I think it's a bigger problem in India, okay? But you know what? There's a ton of things you could do without any equipment at all, okay? And the pulmonary rehab provides a lot of these services. We also have an online boot camp that's free. You don't need machines. You don't need a treadmill. You don't need a bike. You need yourself. You need your body. You need your breath. You need your lungs. You need your mind. You need the ability and the knowledge to know what to do in these situations. And then, as Nike says, just do it. If you don't do it, it's not going to work, right? No matter what it is, if you don't do it, it doesn't work. But yeah, I know that people say, well, I don't have anything, and I know that we were talking earlier today that one of the reasons why you created this was because there's very little access to pulmonary rehab. And that's why we created our boot camp, because you know what? Money or access, here in the US, God, everything is controlled by money, right? Everything is a corporation. Everything is, the hospitals, the drug companies. And money should not be a reason why somebody either gets to breathe or doesn't get to breathe, okay? And we're all here. We all deserve that. And, part of this, and one thing that I talk about all the time is, we have to also think of the environment, and we have to take care and protect the earth, which we're doing very badly, by the way, okay? And we have to protect the trees and the plants and the animals who have equal right to be here as us, right? Absolutely equal right. Like, why do we have the right to be here and this rabbit or this bear doesn't have the right to be here, right? Humans are too smart for their own good. We're so smart that we're destroying the planet. And I don't want to turn this into a sad talk, right? But I saw this thing the other day, and it was a meme, and it showed this is what the world will look like without bees. And it's dark and it's black and there's nothing there. And they say, this is what it will look like without plants and animals. And it's dark and it's black and there's nothing to breathe. And this is what it looks like for if there were no humans, and everything is flourishing. Everything is colorful and everything is growing. And if you think about, what happened with COVID, the ocean got bluer, the sky got bluer. There were more animals. They were healthier, right? So I don't want to say, I'm not trying to make this a preaching rant or something like that. But even if you don't care about the animals or the plants or the trees, which you should, okay, by not protecting them and not taking care of the earth, then we're really doing ourselves a big disservice. So even if you only care about yourself, right? Sadly, there are people who only care about themselves, but it's still to their advantage to take care of the earth properly. Rant over. I apologize for that, but it's really true.
So before we started, you showed us your lovely pond. The living wall is the feature of your center, which we love, and amazing plants. I'm sure you are making a difference as well. Right?
Thank you. I mean, it's so important. And animals feel just like we feel. They don't speak, but they have the same feelings, right? I mean, you see it all the time. I can't go on this topic anymore. I apologize. I'm going to get too emotional. I have to stop right now. But there's a question that I see that I really like. And it's from Shravani Kale or Shravani Kale.
Sorry.
Got it. Okay. So it says, my opinion about adding incline as a progression during treadmill training. Okay. So you read the chapter. Okay. You asked about that, and what that has to do with is it refers to MET level. Okay, let me see if I can pull this up quickly. If I can't pull it up, then I will provide the link. But let me just take a quick look to see MET chart. Okay, I do have this. So I'm going to share my screen for a second. And I will provide this to you guys later today to share with your group. So what this is here is this is a MET chart. And when we talk about METs, we're talking about metabolic equivalence. And essentially what that means is it means workload, right? So it means pound for pound, orange to orange, apple to apple, how much work can your body do? And along this bottom here are speeds, right? So this goes from 1 mile per hour to 3.8 miles per hour. And over here is inclines. And the inclines go from 0 to 15%, right? And why incline is so important to you, okay, is the following. So if you go at, let's say, 1.6 miles per hour, then that's 2.2 metabolic equivalents if there's no incline, right? But if you add just the 3% incline, well, now it becomes almost 3 METs. And if you add a 7% incline, it becomes almost 4 METs, right? And a lot of times people think that walking faster is walking better. But if you look here at even 3.9 miles per hour, 3.9 miles per hour is only 4 metabolic equivalents, right? But most of us would have a hard time walking at 3.9 miles per hour, right? But look what we do here. If we cut that in half and work at only 2 miles per hour, but add a 5% incline, then we're still at that same level. And what I'm trying to say with this, okay, is that incline gives you a lot more bang for your buck. Like, I know people who can walk around New York City and who can map out the city by where there's inclines, and they will avoid those like the plague. I know people who can map out the city by where there's a place to sit down, right? I know people who can map out the city by where there's a place where they let you use the bathroom, even if you don't buy something, right? But incline is very, very, very important. And while we're on that subject, are you a physio?
Yes, Shravani is a physiotherapist.
So another thing is that getting the right test is also very important, right? So I know that a lot of people use the 6-minute walk test. The
Yes,
6-minute walk test is okay. Okay. If you have absolutely nothing else, it's okay. But the thing about the 6-minute walk test that makes it a little bit unreliable, and I know I could argue with people about this all day, every day, and there are people who are going to say, you know what, the 6-minute walk test is the most reliable test, but the patient is in control of the test. And sometimes people say, oh, you know what, they'll sometimes run and then they have to stop. Sometimes they'll walk very slow. Sometimes they'll say, oh, don't do too good on the test, or they're going to take away your rehab, right? It's too controlled. The treadmill test is, in my opinion, the best test. It's better than a bike because most people don't bike, right? We have to walk. That's essentially why people come to rehab, because they want to walk, right? And so let's test them on the thing that we want to work on the most. But then also it's very important to do the right test. If you look at the test that they use for diagnostic testing, most people use the Bruce protocol. And the Bruce protocol starts at 1.7 miles per hour, 10% incline. So if we think about our average, patient with COPD or pulmonary fibrosis, if we put them on at 1.7 and 10%, they get thrown off the treadmill, right? Or they're working so hard and they get so short of breath. And then they say the patient is negative for coronary disease, but there were no cardiac endpoints reached during the test because the patient was too short of breath or their legs were too tired, right? So we use a protocol that starts at less than 2 minutes. It only starts at 1 mile per hour, and it's 2 minutes. And then it goes up to 1.6 miles per hour and 2.5% and 2.2 miles per hour. But that allows us to find out the most about each patient, and to find out things that we can really use to steer their program. But you have to really go to those high levels of exertion, because that's where lung function improves. Okay. If you read the literature about cardiopulmonary rehab dating back 30 years, they'll say patients feel better, patients can do more, they're less short of breath, but no improvement in lung function, right? And the reason for that is because most rehab programs don't exercise people vigorously enough to improve lung function. I see improvements in lung function all the time. And it's because by hook or by crook, even if I have to give you 100% oxygen to do it, we're going to get you working vigorously. And that's how you improve lung function. So yeah, incline is important. Someone wrote, sometimes incline brings pressures on the knees. I read your book and it's giving great results on the but knee pain is something which is a concern. Absolutely, that's a concern. But that leads me to...
most people have this concern that knee pain, back pain, if they do treadmill, they will land up with the issues. Because that's why they're reluctant to do treadmill.
Right. And that's something that doctors tell patients all the time. They tell them all the time. They'll say, oh, you know what? You have back pain. You can do treadmill, but don't use any incline. Or they'll say, don't use treadmill, use the bike, right? But using the bike doesn't help you walk, because in using the bike, your weight is supported. So it's okay, but it's not going to do what the treadmill does. The other thing is that I will provide the Benson protocol for you. So I will provide it to you guys, and then you can share it. The thing about it though is that if a doctor tells you don't walk on the incline, right? What are you supposed to do if you're walking in the street and all of a sudden there's a big hill? Do you have to go around the block so you don't go up in the incline? There's a saying, and it comes from the book 7 Habits of Highly Effective People by Steve Covey, and it says, keep the main thing, right? And what that means is that we all have that one thing that is at the top of the list of preventing us from doing the things we need to do. So what I mean by that is, guess what? It may be shortness of breath, right? And you may not have any knee pain because you don't do any activity, right? Or you may not have any chest pain because you don't do any activity. But then when you start to do more activity, well, now some of these things kick in. But it doesn't mean just back off the activity. It means let's find a way to modify the activity so that you can continue to do it, right? Like a lot of patients with respiratory disease, often what happens is their heart disease is missed, right? It goes undetected. Why is that? Because just what I just said, if you've had COPD for 20 years, or if you've had pulmonary fibrosis for 10 years, then everything gets attributed and blamed on your respiratory disease, right? So, oh, I have chest pressure. Oh, that's your pulmonary fibrosis. But maybe it's not, right? Or they do a treadmill test and the test is stopped because you're short of breath long before you get to the point where you would find heart disease, right? And so what happens with a lot of patients is they get into good shape and then we find out, hey, they have heart disease also. Now, the heart disease wasn't caused by the exercise, but it was being masked by the fact that the person couldn't do the things that, will allow them to do it. So I think that you're right. The knee pain's an issue. I think you have to know what the problem is, right? So if it's just discomfort, and I'm not minimizing discomfort, of course, pain is a reason to stop, but your knee is stable. You don't have severe arthritis, your meniscus and your ligaments are okay. Then I would say maybe take some pain medication 15 minutes before you do the exercise that will allow you to do the exercise, right? Now, some people will say that's a bad thing, and it could be a bad thing also because it can mask the pain, right? So we're not looking to mask the pain so that you overdo it, but we have to know what is the knee problem itself, what is the back problem itself. So yes, some things will be made worse by some exercises, but also some things will be made better because think about it. If you take some pain medication and your arthritis can be quiet for a little while and allow you to now do this workout. If the muscles around the knee become stronger, then the knee will actually become more stable. So again, there's no one answer for everybody. But I think if you have to say, what is the main thing that's preventing me from doing this and checking it out and making sure that it's not dangerous, as long as it's not dangerous, then there's ways we can work around it.
So it's one plan doesn't fit everyone. That's what
Absolutely
one has to
not.
remember.
Absolutely.
So if I may just interrupt, then hello?
You can
Yes,
put
we
your
hear you.
queries in the, yeah. So Satnamjit Singh is asking any tips to control aggressive persistent cough that is a side effect of chronic ITF.
Yep. So
And
that's
there
a
was
tough
one
one.
more question: how to manage chronic cough in PR by Kishore Kumar.
What was that other one? Chronic cough for what? I'm sorry.
Chronic cough in PR, pulmonary rehab. How do we manage that?
In pulmonary rehab. So chronic cough can be a real problem for people with pulmonary fibrosis and interstitial lung disease. It can actually be the biggest problem. About 15 years ago, I bought every single type of cough drop and throat lozenge on the shelves and tried them out with different patients. And one thing that we found that was very, very helpful was a product called Fisherman's Friend. Okay. And now millions of people use it. We told everybody about this. Fisherman's Friend company should send me a big check. But the idea is that this really works for some people. And it's very, it's strong and it's menthol. Okay. So the thing is, it's a strong mint, but I know for people who continuously cough and cough and cough and cough, then, not coughing is a blessing. And so Fisherman's Friend cough drops is one. The other thing is that why do people cough? There's a lot of reasons why people cough. With interstitial lung disease, it's not usually the same reason as, let's say, somebody with bronchiectasis or COPD, where mucus is the problem. In interstitial lung disease, it's more often, an increased sensitivity of the stretch receptors of the lung, or increased spasm of the airways and the smooth muscle that line the airways. And so it's almost like if you wanted to take a breath in, your body's going to naturally rebound and tighten up in the same way that if I tried to do a split, my leg muscles would be like, wait a second, we're not doing a split, right? One thing that I think helps is to start off with something that I call the breathing scale. And what I do is sometimes you find that you'll cough more when you exercise, right? And what's the reason for that? It's because you need a deeper breath. The demand is greater, right? So what I recommend to people is start off in the same way if we were going to stretch your muscles, right? We don't start all the way out here, but maybe we start here, right? Then as that loosens up, we go here. As that loosens up, we go here. As that loosens up, we go here. So same thing. If for a lot of people, the cough comes, for a lot of people, it doesn't matter what they do, the cough is there. For many people, the deeper they breathe, the more they're going to cough. And so I recommend start off 2 breaths in, 2 counts out. No cough. 2 breaths in, 2 counts out. No cough. 2 counts in. When that becomes easy, I'm going to raise it up a little bit. I'm going to say in for 2, out for 3. In for 2, out for 3. In for 3, out for 3. In for 3, out for 3. In for 3, out for 4. In for 4, out for 4, and so on and so forth. The cough associated with ILD is very, very tough. Okay, it's very tough. But there are some things that help. The other thing I want to say is that bronchodilators are usually not recommended for people with ILD. And why is that? The reason is because when they have a pulmonary function test and they have, when they get tested and the bronchodilator is tested, they don't show a great improvement, right? So they say, oh, this is not effective in people with ILD. But the thing is that the pulmonary function tests are difficult tests for people with ILD. And they're also difficult tests for people with COPD, okay? And I just want to say, and not everybody agrees with this, but in my experience, I have found that sometimes even if the pulmonary function test doesn't show that you respond to a bronchodilator, sometimes symptomatically you do respond to a bronchodilator. And so if you can get a doctor to do it and give you a try, like a nebulizer with albuterol or something like that. Again, it's not always something that doctors want to recommend because they don't believe that bronchodilators work for people with ILD. But again, sometimes even when the pulmonary function test doesn't say that it works, sometimes it can make you feel a little better. And ultimately, the test, we don't live for the test. We live to live, right? We want to do what's best for ourselves. I know that's sometimes hard to get help for.
Thank you for that. I want to know is, do you incorporate yoga or pranayams in pulmonary rehab there?
So we recently added somebody, and we're going to start to add more of it. Okay, but I'm an absolute believer in it. Okay, I'm an absolute believer in yoga. I think it's great for the mind-body connection. I think it's great for our musculoskeletal system. I think it's great for the breath. The other thing about it is, a lot of times people, like, if you stand on the street corner and ask a bunch of people, what's the best exercise? You'll hear everybody tell you what they think is their best exercise, right? There's not one best exercise for everybody. And I know that I always say the treadmill is the best exercise. That would be what I choose, but it doesn't matter if it's yoga or Pilates or something else or pranayama breathing or what have you. You have to do what makes you feel best. And, in the same way, it has to do with like a food preference. If you sample many different foods, your reliability is going to be much greater than if you only have a grilled cheese sandwich, right? So I encourage people to try different things and see how they feel. If you try yoga and you say, hey, you know what? Yoga helps me breathe better than the treadmill. Fine, do yoga. I don't care. I don't have to be right. It doesn't have to be my way or the highway. I want you to find what works for you. But yoga, I can't possibly say anything bad about it.
So it's like keep moving, come what may.
Absolutely. Like I said before, I said, Nike says just do it. I say just do something, okay? Because anything is better than nothing. So, there's a saying by Martin Luther King Jr., and it says, if you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. And not that Dr. Martin Luther King needs any help from me, but I added one additional line to the end, and I say, if you can't crawl, then breathe, right? Whatever we could do at this moment, that is what we do. And it's like if you're trying to save money, okay? Some days it may not be there, right? Some days you may have only a penny or a nickel or a quarter. Put that in the bank, okay? Some days when you're feeling better, you may have $1 or $5 or $20. I had a yoga teacher named Stephanie Pope who used to say, as long as you're giving 100% of the effort, you still get 100% of the benefit. And don't worry, oh, I'm not doing as well as yesterday. Don't worry, I'm not doing as well as that person next to me. Don't worry about, oh, you know what? I'm not doing as well as I did when I was 18 years old. Just do something and get going on something, because again, the body gets good at doing what you ask it to do.
So in India, most of people are fascinated with yoga and pranayama.
Yeah.
And we have a unique initiative in that as well, Pulmo Yoga, where we have a certified trained yoga person who is taking care of all lung patients and doing certain pranayams, very simple pranayams, which are safe for people to do. And we scrutinize each and every patient before enrolling. We have seen that certain techniques like Om increases or improves oxygenation.
Absolutely.
There is Brahmari, which helps in airway clearance. So there are certain benefits to certain pranayams, but they should be known by people what is to be advised and customize it accordingly. As you rightly
Absolutely.
said.
How long has yoga been around for? Probably millions of years. Well, certainly
Yes.
hundreds or thousands of years, right? Maybe not millions. But the things that stick around, there's a reason why they stick around.
True. So we do have a question here is, give some tips for home-based aerobic exercises other than treadmill and cycling.
Okay. So many people with respiratory disease have trouble with overhead activities, right? Washing their hair, taking a shower, getting dressed, making the bed. And if you think about what I told you before about, about open chain versus closed chain activity, that makes perfect sense, because these activities put the respiratory muscles at a poor mechanical advantage, okay? And so you get short of breath. And so there's something that we do, and we didn't invent it, okay, but we do it. I believe I learned it at the University of California, San Diego, about 20 years ago, and it's called armor size, okay? And if you don't know it, it is a very valuable tool, and it's a bunch of different exercises that that work all of the upper body muscles, and it's aerobic, okay? And it helps with that overhead activity, helping to make your body more efficient. Okay, so this is what we call walkabouts. And the walkabouts are walking. We show pictures that we filmed all over the world, but what these do is you can walk in place, okay? And there's different steps, but I'll show you this.
Through different parts of the world, because I'm sure the last thing you want to see is me walking in place for 15 minutes.
So as we do that,
I'm going to give you access to beautiful scenery.
this is armor size, and I can also make that available.
Why is it so important to do upper body aerobic exercise? When people have difficulty breathing, or they have a respiratory issue, or they have some type of dysfunction in their cardiopulmonary system, upper body exercise is particularly difficult.
So this is punching bag.
Because it puts the respiratory muscles at a very poor mechanical advantage. So it's very important that we train those muscles so that they get stronger. They become more flexible, the thorax becomes more flexible, and they become better at using oxygen.
punching bag, it's marching soldier, it's stir the soup, it's climb the mountain. And by doing all these different things, you cover every muscle in the upper body, and it's fun and enjoyable.
So we do have suggestion that chair aerobics is also a good option, and even
Absolutely.
bedside cycle or ergometer for aerobic arm training.
Absolutely.
That's great. So what, according to you, are less emphasized but most important areas in pulmonary rehabilitation?
Less emphasized and most important?
Yes.
That's a tough one because they're less emphasized. They're hard to think of. But, you know, again, I think that the 5 keys are really making sure patients know how to take their medication, right? Is really important. And, you know, here in the US, like everybody was so excited because now we have these triple therapies, right? Like Breztri and Trelegy. And one thing that people don't like, if you think about it, for the people who are short of breath, one of the hardest things for them to do is to coordinate their breathing, right? And so if you're using an inhaler, that's one of the hardest things to do, is to make sure you take a breath in and blow all the way out and press this at the exact time that you take a breath in and get it into your lungs. And so studies a lot of times will show that people only get 20% of the medication, right? And if it's a triple therapy that has an anticholinergic, 2 bronchodilators, and a steroid, think about how much medicine is being wasted. And even worse, you're not getting the benefit of it. So one thing I would say is that even though people don't generally like a nebulizer because it takes a lot longer, it very often can make a much bigger difference and be much more effective, okay, than an inhaler. So that's one thing. The other thing is that spacing your medications out properly and taking them in the right order is also very important, because you have 3 different medications, right? And they take time to work. So to me, if you have 2 bronchodilators, I would like you to take them separately. I'd like you to take one at a time and let it start to work a little bit so that your airways open up. Then add the second one, because when you add the second one with the airways open more, you're going to get better delivery of it, right? And then take the steroid third, right? And then another thing that a lot of people don't know, after you take a steroid inhaler, very important to rinse your mouth out very well, spit it out, gargle very well, and spit it out. Because if that steroid stays in your mouth and your throat, then you can develop a fungus called thrush candida, right? And you'd be surprised how many people are given steroids but not told about that. And it's very, very important. Some patients will say, oh yeah, I brush my teeth. We're not talking about brushing your teeth. We're talking about getting the medicine out of your mouth and your throat. Those are 2 things right off the bat. What else? I think those are 2 good ones.
Okay. Any other issue? Another issue that is bothering me of late is I become breathless with little bit of effort, like washing hands, changing dress, even when oximeter shows acceptable level of saturation, say 92, 93. What could be due to and how to handle it?
So, you know, one thing that I say over and over again is that breathing is multifactorial, meaning that there are many, many factors that go into how well or how poorly we breathe. So to say that I know what the issue is would be crazy, okay? It could be many different things, but the things I would ask you are, have you become less active over time? Are you taking your medications properly? Have you put on or lost any weight? What has changed, right? And we have to find out, well, what's different and what has caused your body to somehow make this adaptation? Is it that you stopped rehab? Is it that you stopped exercise? Is it that you put on 20 pounds? It could be a lot of different things, but what you can do about it is, you know, make sure that you're taking your medications properly. When you're doing these exercises, okay, like washing your hands, make sure that you're doing the controlled breathing techniques. Breathing in, wash, 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 wash. Breathing in, wash, 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 or changing, getting dressed, breathing in, put the dress on. But it's, you have to really ask yourself, what has changed in my life? And that's why it's helpful sometimes to keep a journal of your exercise and your food and your medications so that, nobody remembers everything that they do. But if you say, hey, you know what? In the month of June, I was walking 3,000 steps per day and I've cut back to 2,000 steps a day. Well, your lungs haven't gotten worse, but your body has become less conditioned, and that can increase your shortness of breath.
So it's more about deconditioning, right?
It could be deconditioning. It could be deconditioning alone. Sometimes it is deconditioning alone, but it could be a number of different things. And, one thing to keep in mind is that if all of a sudden your breathing gets much worse, or all of a sudden you're getting chest pain or pressure, or you get these symptoms at lower levels of activity, it's always best to get them checked out. Make sure your heart's okay, make sure your lungs are okay, make sure that you're not sick. I always encourage people to err on the side of caution and safety.
True. So are there any unique support system or resources available in New York for individuals with lung problem? And how can someone living in India learn from this or access these?
So there are, we do a number of web-based programs, usually at least one a month. We also have an online support group on Tuesdays and Thursdays for lung patients. And on Sunday nights, we have an online support group for long COVID patients. And so if you would like to get on our mailing list or something like that, just go to pulmonarywellness.org. I could put it in the chat and sign up, and you'll get announcements of everything that we do. And, there are many programs from many different organizations that are very valuable. And I encourage people, again, like everything else, same with the exercise, try different things, try different groups, try different organizations, and see what works best for you. Not everything is going to work best for everybody.
True. And any latest advances or recent update that you have come across which would benefit people?
So for me, I can't say that there's anything that is, again, everybody wants the most recent, newest, special, car with the bells and the whistles and all this and that, the everything. I think what works the best are the basics. So if you're not exercising, exercise. If you're not 100% sure that you're taking your medication properly, review how to take your medication properly. If you're not watching what you eat, learn about pulmonary nutrition and watch what you eat. If you're dealing with stress and anxiety and depression, get help with dealing with your stress and anxiety and depression. And incidentally, breathing exercises and exercise are very, very effective in dealing with stress and anxiety and depression, okay? They release a lot of positive chemicals. So before, I was talking about the sympathetic nervous system, the fight or flight, even worry can cause adrenaline to move through our system, right? And you're supposed to fight or run away. But if we're having these thoughts and these thoughts are driving the adrenaline system, that makes us very nervous, very anxious, okay? So I don't say that there's anything that I've seen that's like so new or so great, but I think really examine the basics and see what you're doing and what you're not doing and see where you can do a better job with the basics.
Okay, I think so. Stick to basics is the most important key message that one should take away today.
Stick to things that are going to give you a lot of bang for your buck. It's like I tell people, if you win a free shopping spree in a supermarket, don't go to the gum aisle, right? Go to the TVs, put some TVs in your thing. Don't go for the gum and the mints, go for the big ticket items. And that's, again, the breathing techniques, the exercise, the medicine, the nutrition, managing your emotions. That's where the key lies. And prevention of infection, of course. So vaccinations are very important, frequent hand washing, masking in social situations. How's the mask situation where you are?
So currently people are not masking that much or not taking vaccines about, especially for COVID. Pneumonia, herpes vaccine is what recently people have started. Flu vaccines, they are being regularly vaccinated, but COVID, not much, to be
Yeah.
frank.
Yeah, it's still there. It's gotten better, okay? But some new research came out in the last few weeks that shows that the more frequently or with repeated infections, the greater chance you have of developing long COVID, right? So to me, I think that COVID vaccine is still valuable.
Right. So we will definitely encourage most of our patients to take vaccines against COVID as well. What would be your 5 tips for lung patient? Apart
Ultimate
from
pulmonary wellness, medical, having the right doctors, taking the right medication, exercise, eat right, manage your stress, anxiety, and depression, and prevent infection. That's it in a nutshell.
Thank you for that. And what is the one advice that you would give to your younger self? So all the physios who are listening today
Oh my
would
God. Younger
definitely.
self? I would say don't do anything that I did. That would be the advice. Like whatever you're thinking of doing, don't do that. For me, I've been very, very lucky in my career. I wound up somehow with the dream job, mostly by accident. Okay. But I made a lot of mistakes along the way. And I would say to somebody, number one, you are not your mistakes. Okay. You're not perfect, but you are not your mistakes. And I would say try everything that you can, right? Like, and when it comes to, let's say, art or music or fashion or exercise or sport, try things. You never know what you're going to be good at until you try. And a lot of times we think to ourselves, oh, I'm not a good artist, right? You say, I'm not a good artist, or I'm not good at math. These things take training. They don't just come to you, right? And then the real final thing I would say, it's a great quote. And it says, I don't remember the exact numbers, but it says something like, fall down 7 times, get up 8. And it means keep fighting. Things are going to go wrong in your life, okay? People are shocked when something goes wrong. I've gotten to the point where I'm like, you know what? Something goes wrong. I'm not so shocked anymore. I expect things to go wrong. And if you prepare for the worst, and then if it doesn't come, well, then all the better. But, keep moving, keep pushing, keep striving, keep breathing until you're dead. When you're dead, you can stop, as far as we know. But until we have proof of otherwise, but yeah, don't give up. That's the number one thing. Don't give up.
I'm sure that's the most important thing that you have mentioned us today.
And I just want to thank you so much for your attention. I want to thank you so much for the invitation. It was, I think I invited myself, but it was a pleasure. You did ask me in 2014. You just didn't know that it was going to be this. But
I manifested it, to be frank.
Manifested it 9 years ago, and it came. But it's been a pleasure. And I just really encourage people, don't give up. You can always get better. You can always get better. There's always a little something that we could do. Even the greatest professional athletes, there's something they can do a little bit better. And that's what we're striving for. We're striving for a little bit more each day. And if it's not there that day, it's okay. Try again tomorrow.
Really great that you could shell some time and give us wonderful insights. I'm sure both physios as well as pulmonary patients have got a huge insight and would make a difference in their lives.
Have a wonderful evening, everybody.
Thank you, everyone. Good night. And thank you, the Pulmonary Rehab team, for organizing and arranging everything. Thank you so much.